the most wonderful time of the year, except perhaps for your gallbladder. Coming up on today's Morning Medical Update, 4 main factors that put you at risk.
And I wasn't ready to say anything before. But I'm ready now.
Celine Dion is postponing tour dates after revealing a rare and devastating diagnosis. On today's Morning Rounds, we learn what stiff person syndrome is and the long-term impact. Good morning. It is Monday, December 12th. I'm Jessica Lovell. Welcome into the Morning Medical Update. We are live here inside the Dolph C. Simons Jr. Family Broadcast Studio. We are all sure to indulge some rich foods and sweets during the holiday season, but those choices can potentially put your gallbladder at risk. So make sure you get your questions sent in to us here on YouTube, Facebook, and the Medical News Network. You can find links to all of those right here on your screen. But first, we are making our morning rounds. Singer Celine Dion reveals she has stiff person syndrome, forcing her to cancel her February tour dates. Stiff person syndrome is an extremely rare disorder that affects the brain and the spinal cord. She says it is impacting her ability to sing and sometimes even walk. We are joined this morning by Dr. Murtaza Khan, an epidemiologist specializing in neurological infectious disease. Dr. Khan, good morning to you.
Good morning.
So what is stiff person syndrome, and does it have a more technical term?
Yeah, stiff person syndrome is an autoimmune disease that was first described in the 1950s at Mayo Clinic. We obviously know a lot more about it now than we did back then. And it is a sweater disease caused by an antibody called GAD65. And where that antibody specifically attacks can lead to a wide variety of symptoms, one of them being stiff person syndrome.
So Celine Dion mentioned struggling with spasms. Is that a symptom that we would normally see? What other symptoms?
Yeah, that is a hallmark of that disease. Stiff person syndrome, again, being progressive, has a variety of symptoms associated with it. Stiffness, as the name implies, with a lot of difficulty walking, is one of the main symptoms. Spasm is another one. And then again, if people have a very progressive form of it that specifically involves the brain, it could lead to seizures as well as uncontrolled epilepsy.
So it's extremely rare, we're learning, impacting about 1 in a million. What causes it?
Yeah, the number 1 in a million, again, it still remains extremely rare, but it's a progressive disease with a wide variety of symptoms. So sometimes it is harder to diagnose. In terms of the cause, we're not quite sure. Part of it, as with other autoimmune diseases, we think it has a genetic component in it, so people are predisposed to mutations. We think that there's probably an environmental component to it, though we haven't found any specific triggers. And unfortunately, sometimes it is just bad luck with the wrong circumstances that triggers it.
So she mentioned in her Instagram post that she's been working with a sports therapist to build back her strength. But what other ways do you treat this? And most importantly, is there a cure?
Sure. I think, first of all, sports medicine, physical therapy is a great way that I treat a lot of my patients with it. More specifically, hydrotherapy, which is a form of physical therapy that takes away the gravity component so people can really push themselves. It's a balance, so you have to make sure that you're not overworking the muscles, which can worsen the spasm, versus under-treating it. But in terms of treatments, there's symptomatic treatment, so you have to treat the muscle problem and the spasms themselves. We use a wide variety of medications like benzodiazepines as well as muscle relaxant. And then you have to go after the underlying cause. So a lot of times we use immune therapies in conjunction. So going after the cause and going after the damage.
You said since she made her announcement that people have been asking you about this for the last few days. Makes sense, but you're not treating her, as we know. But in your opinion, do you think we'll see Celine Dion take to the stage again, or is this the beginning of her just full-time taking a step back due to this disease?
Sure. It really depends on what's been instituted so far and kind of her response to therapies. I think this is a treatable disease. We don't have a cure, just like we don't have a cure for, say, type 1 diabetes. But we can manage the symptoms very aggressively. There's a lot of treatment options, and there's a good chance that she could be coming back.
Well, that is good news. Dr. Khan, thank you for just helping us better understand exactly what this very, very rare disease is.
Sure.
Have a great Monday. Thank you. Well, you may have heard the gallbladder referred to as an unimportant organ, but it can be an essential part of your digestive system. Eating large, fatty meals can disrupt digestion, and of course lead to gallstones or gallbladder disease. Experts estimate as many as 1 in 12 Americans have gallstones, but most people don't even know they have them, and they have no symptoms. We are pleased, of course, to welcome today Dr. Benjamin Stone. He's a surgeon here at the health system to kind of help us understand exactly what the function of the gallbladder is and how to keep it healthy as we head into the new year. So what is it? Can I live without my gallbladder?
Certainly. So your gallbladder is part of the digestive system that helps us process fats. It works in conjunction with the liver, so that when you eat fatty food, which we're all getting ready to eat a lot of this holiday season, the gallbladder stores bile, and it releases that bile in response to fat entering the stomach, so that when that fat exits the stomach and goes into the small intestine, you've got some of that bile that the gallbladder contributes and that the liver contributes to help you digest that fatty meal.
All right, so let's talk about gallstones. When do they become an issue? How would you? I always think of them as being painful, but maybe I'm thinking of something else. But tell us why we don't feel that.
For about half of the people that have gallstones, they will have symptoms. The other half often can go through life without any symptoms from their gallstones. So they become an issue once they become an issue for people. That symptomatic gallstones, that could be nausea, vomiting, pain in the right side, or any combination of those things. That's usually when a patient will go see their primary care doctor and then be referred for either further testing or referred to have their gallbladder removed.
So, okay, but let's go back to gallstones. Can they dissolve on their own? How does that work?
So because of the unique anatomy of the biliary system, you don't particularly want to break gallstones up. They're not like kidney stones. The debris that they would scatter to the bile ducts and to the pancreas potentially could cause pancreatitis and blockage of the bile ducts. So we don't dissolve gallstones.
So do you see an increase of patients this time during the holidays? We talk about the fatty, I asked you fatty foods, and I said, does that include like ice cream? And you said, yes, Jessica, fatty foods. So I'm trying to sneak in some of my favorites, but you're saying it's a nice try, it isn't gonna happen.
Yeah, any fat that enters the stomach, there are receptors in the stomach that send a signal to the gallbladder via some nerves. So it doesn't matter whether it's healthy fats like salmon or those we like to indulge in like ice cream or pumpkin pie. Your ham has fat in it, and that will activate your gallbladder, which is normal. When there are stones and the gallbladder is activated, sometimes those stones get in the way of the gallbladder emptying appropriately, and that's where problems come up.
Okay, so you said the good, the bad, and the ugly, the healthy stuff and the non-healthy stuff. Can affect your gallbladder.
Yes.
Okay, so we want to make sure that you can get connected to our gastroenterology teams here at the health system. We're putting up a QR code here on your screen that just kind of gives you more information about what we're talking about and find out more about options for gallbladder removal and treatment for those gallstones. So when we talk about a food coma, eating too much, we talk about it this time of year, is that actually a sign that we're putting strain on our gallbladder?
I guess, depending on what you mean by a food coma, every time I've put myself into a food coma, it's because I've eaten too much. And I usually think of that in terms of carbohydrates. So our pancreas releases a lot of insulin. That causes the sugars to leave our blood system, and you get tired as a result of that.
Yes. Okay, sleepy. Okay, so let's talk about the top 4 factors that can affect having gallbladder issues. I was surprised because female, 40, fertile, and
excess weight.
Yeah. Why females?
So there's an interplay. There's a relationship between bile salts and the things that the bile is supposed to dissolve, like fats, lipids, cholesterol, and the estrogens, progesterones, that make those things a little bit more easy to fall out of solutions, kind of like forming a snowflake. Things crystallize when there's too much of it, when things get saturated. If you've ever made Kool-Aid as a kid and you put your own sugar in, I know I would keep dumping it in and it would settle out.
Yeah.
The same thing happens with the fats that our bile is supposed to be dissolving.
So is there any good foods that help kind of counterbalance that fat?
Broadly speaking, fiber helps bind up fat.
Okay.
Eating a low-fat diet is another good way. But we also see issues when people are rapidly losing weight. So for people who are intentionally losing a lot of weight, or people who have bariatric surgery, colloquially called like the stomach bypass, the currency that the biliary system deals with is fat. And if it's processing a lot of it, you can saturate that system, and then stones precipitate out.
So if you have gallbladder issues, do you have to remove the gallbladder, or are there other treatment options?
Typically, I'll say typically when the gallbladder starts to dysfunction, it will continue to dysfunction. You might have some good times in between episodes of dysfunction, but usually once it starts to act up, it continues to not do like it should. And
so best to just do away with it?
Yeah.
And how do we do that? What kind of procedures and treatments?
So there are a number of procedures. I would say for most people who are just having symptoms, who are not sick in the sense that they don't have pancreatitis or they don't have a blockage in their liver or bile ducts, we simply do what we call a laparoscopic cholecystectomy. We can put a little camera in near the belly button and about 3 or 4 5-millimeter incisions, and through those small incisions we can do some pretty big surgeries. And we simply disconnect the gallbladder from the liver and from the bile duct system, take it out. It takes about 30 minutes. It's usually an outpatient procedure.
So once the gallbladder is out of the body, then how is the body functioning with what it was doing before? Now it doesn't have it. So now who's doing all the work? The liver?
So yeah, the liver can make bile on demand. So
Okay.
you eat a piece of pumpkin pie, and the liver will actually synthesize bile and send it down the same pathway that it had before. And for most people, you don't recognize any difference in how your digestive system works. That's plenty bile to absorb whatever it was that you just ate. I always tell people for about 10% of people, they can have some malabsorption of that fat, and that can cause some looser stools.
Okay.
But for 90% of people, I expect that you should be able to eat whatever you want without the symptoms that you previously would have had with the gallstones.
All right, we're going to have some questions for you here from our audience in just a moment, but let's check in with our COVID count. Dr. Dana Hawkinson, Medical Director of Infection Prevention and Control. With our numbers this morning, how are we looking?
Yeah, numbers have gone down a little bit from last week as far as the active infections. Right now, again, on the top line, we have 53 total infections, but we're really focusing on that second line. So 34 active infections, unfortunately 8 in the ICU, and 3 of those on the ventilator. So still fairly high numbers, certainly higher than we've been used to when it was down in those high teens and low 20s as well.
All right, several Mpox researchers, they used to be called monkeypox, it's now called Mpox. They warned that the disease would go global. It did. Can their insights help to stop its spread and prevent future outbreaks? Kind of where are we with this Mpox?
Yeah. So again, just as you said, it was monkeypox. They said they were going to change the name. I think everybody was in favor for that. It took several months, and it's really unclear why, but they ended up going with just Mpox. So, but that is what we are calling it now in the clinical disease, Mpox. So certainly we've seen around the world cases have gone down. That question about what to be done or what had been done and surveillance, that is a multi-layered question. And yes, people did warn about that. And I think it goes to, nationally, what are we doing, but around the globe as well. And it's just infrastructure. It is setting up global infrastructures to identify, to look, to do this surveillance for emerging infections. And it's not just with Mpox, because again, we knew that disease entity was out there for quite some time. Could it maybe have been handled a little bit better in other countries where we knew that it was endemic and it was causing a lot of disease? For sure. So there are a lot of different social, scientific, and governmental levels that we can assess this. But the main thing is there can be other diseases that can emerge, and I think it is vitally important to set up those global and those local surveillance facilities and institutions so that we can be on the lookout for those and be alerted as soon as we see, a signal of something that is not right.
The CDC is set to expand wastewater testing for poliovirus in several states. We know that they used wastewater testing for COVID in Missouri. Your thoughts, and what can this tell us? Yeah,
we know polio is being looked for in the New York State wastewater as well. I think it's good. I think we should do this this surveillance. Again, just going back to even the Mpox story that we just talked about, we need infrastructures there. We need that surveillance to be looking for those things. Most importantly, if we are talking about polio, I think most of us would maybe expect to find it because you still are using oral polio virus around the world, and certainly we know you can shed that after getting oral polio virus. But the main important message here is that if you are up to date with your vaccines, those childhood vaccines, they won't pose a threat as far as active disease. But I think it is important to know and understand, any distribution or, for instance, in wastewater testing, not only here but around the nation as well.
All right, Doc Hawk, thanks so much. Any reporters on the line today? Let's get to our community. Dr. Stone, Jeff wants to know, if you have to remove a gallbladder, do you have to be on a special diet before or after the surgery?
So typically I will recommend, Jessica, that people avoid foods that have a lot of fat in them before surgery so that we don't exacerbate another episode of gallstone disease. About a third of people, if we give them 6 weeks between their last episode, I would expect about a third of people will have a repeat episode of a gallbladder attack or cholecystitis. And about 2/3 can march on indefinitely. So avoiding fatty meals prior to surgery. After surgery, no, you should be able to go back and eat anything that you'd like without fear of the same repercussions that would have happened before.
Okay, interesting to know. Question from Lisa, wants to know if acid reflux is related to gallbladder issues.
So the gallbladder lives, maybe 2 or 3 inches from the stomach and the duodenum. So there's a lot of overlap with the symptoms that they can cause. Sometimes the gallbladder can cause pain in the right upper quadrant, or sometimes right under the ribs where they come together, the epigastrium. And a lot of acid reflux disease, a lot of peptic ulcer disease, so we think of stomach ulcers, duodenal ulcers. They share the same vicinity, but true unrelated as far as the pathophysiology of one process doesn't cause or lend to the other.
Kim had a question, and I don't know if she's just jumping in because you did mention it, but she wanted to know what organ takes over after the gallbladder is removed. You said the liver?
Sure. Yeah,
is that what we're learning?
Okay. So the liver actively synthesizes the bile.
Okay.
The gallbladder passively stores it. And so the liver is still actively synthesizing bile before the gallbladder is gone and after the gallbladder is gone. And for most people, that's plenty bile to keep up with what they're eating.
Okay, but it's not putting extra strain on the liver necessarily.
No.
Okay. Yan Liang, Dr. Hawkinson wants to know, how is Mpox spread? Are we learning anything new about that, or at least remind us? And do we need to wear masks to prevent any of that spread?
So certainly you can have spread on those respiratory droplets. It is much less common than, say, for SARS-CoV-2. The major way that Mpox is spread is through that close contact, especially the intimate contact, but there certainly have been cases where other social close contact has occurred as well, and that is the vast majority of spread of this disease at this point.
Teresa wants to know, do you always need to go to the hospital, Dr. Stone, to treat gallbladder? What can someone do at home, and how do you know if you're having like a gallbladder attack?
Sure. Kind of the classic symptoms of a gallbladder attack are, we say, right upper quadrant pain, so pain right underneath the rib. It's usually associated with eating a meal, and for most of the meals that we have, they have some content of fat. We all need some fat as much as it gets a bad rap. It actually helps our bodies insulate, it helps our bodies conduct nerve impulses. So within a few hours of eating, right upper quadrant pain that often radiates around to the shoulder in the back, associated with nausea, vomiting sometimes. Food avoidance of fat, that's the thing that you can do at home. For people that need to come into the hospital, sometimes you need to come into the hospital to have the correct diagnosis. Some people need to come into the hospital to let their gallbladder cool off. So a lot of times when people are admitted for acute episodes of cholecystitis, they'll be in the hospital where they can be on IV fluids, where we can keep an eye on the biliary system to make certain that things aren't getting infected or blocked. Some people need an urgent surgery. Some people who have gallstones, those gallstones can travel down that path and obstruct the ducts that empty the liver and the pancreas, and that can be very serious. And so there's a pretty wide spectrum that people with gallstones can present with, and usually that's best decided by your healthcare professional. At what echelon of level do you need care?
So just because you have gallstones, you can have those removed or have them dissolved, but it doesn't mean you necessarily have to have your gallbladder taken out. But I mean, if you don't need it, you don't need it.
Yeah, if you don't need it, you don't need it. We don't have anything that effectively dissolves gallstones.
Okay, so do you how do they go
so
away?
you take the source of the stones, where the stones typically collect is in the gallbladder.
Okay.
And so we remove the organ that generates the
Okay, so they don't go away. To get rid of
Correct.
them, you take them away.
Correct.
Okay, gotcha.
Yeah.
So nothing you pass. What am I thinking about? What do you pass?
You can pass kidney stones.
Kidney stones. There you go. Okay, so and those are what are very painful.
Yes.
That's why people have symptoms with that. But
Yes.
a gallbladder stone, often you don't feel at all.
Gallbladder stones can pass, and yes, about half of the people that have gallstones will become symptomatic, and that might be mild symptoms of pain in the right side. That might be pancreatitis. That might be blockage of the bile ducts. And so there's a wide spectrum. Most people present simply with, you know what, I've got some pain up here, and every time I eat, it makes me nauseous. Or I have pain that moves to my right shoulder.
And need to see a doctor at that point.
Yeah.
Okay, start asking questions. Patty, last question. Patty wants to know, what should I expect once the gallbladder is removed? Do you feel different? Again, somebody asked, do you have to change your diet? What would it feel like?
Certainly. For most people, it feels better.
Okay.
And you just say, wow, for the last 3 years, I haven't been able to eat without having pain, and now I can, and now I feel fine. For about 10% of people can get something we call post-cholecystectomy diarrhea, which was that malabsorption of fat that we talked about before. That if you eat a really heavy, let's say you have ribs or pizza or make a taco run late at night, some people can have looser stools. That can be fixed through some medications that are simple and easy to take. For 90% of people, I don't expect them to have any issue after their gallbladder's out. For about up to 10% of people, they can have some malabsorption of fat.
Okay, Joellen has an interesting comment. And I had this happen to me because I thought I was having a heart attack too. And I've heard this from women. She said, I thought I was having a heart attack. Nope, it was my gallbladder.
Sure.
Why is that? And I've heard that women do present that differently. Like I went to the emergency room because I was having these horrible pains. They ran every test. It was nothing. In the end, they said it was acid reflux.
Sure. So you bring up a really good question. And for a lot of people, the nerves, I'll say for everyone, but the nerves that tell us what's going on at our fingertip, they're distributed very discreetly to a portion of our brain. I could close my eyes and tell you exactly, probably within a half a millimeter, where you touched with a pen on my fingertip. The same's not true for the gallbladder. The heart sits about right here. The stomach sits about right, just an inch below that, and maybe 2 inches to the right, the gallbladder sits there. The nerves that report what's going on in that area, they've got a block about this big that says something's going on.
In this area.
In this area.
Gotcha.
And so the nerve distribution to those organs kind of plays a role in what we think is going on. And certainly sometimes chest pain that shows up in the kind of the upper abdomen, lower chest, that could be the heart, that could be the stomach, that could be the small intestine, that could be the gallbladder. So there's quite a big overlap.
Well, that doesn't help. So what are we supposed to do? Because I couldn't live it down. We had like a big old bill from my husband was so mad at me because I went to the ER and he's like, "You have acid reflux." I've never lived that down. So
you did the right
but
thing.
I thought I did the right thing.
Absolutely.
I really was scared. I'd never felt it before. I was even feeling like it in my neck and like it was like on one side of my neck and it was just really strange. So yeah, what do we do when we feel all these weird? Yeah, I do think I did the right thing.
You did the right thing. You go in and have it checked out, and that it often takes years of training to discern, and it takes a team of people. I don't want to misconstrue that there are often the radiologists are involved, the primary care physicians are involved, gastroenterologists, surgeons. There are a lot of people that come to the table to help figure out what's going on. So hopefully we're doing the right thing for our patients.
Okay, Angela wants to know, some people have phantom pain after surgery. Is that correct?
That can be correct.
And all sorts of surgery, right?
Yeah.
Tell us what you know about that, because we hear about that. But
So classically, phantom pain shows up with people who have had either therapeutic or traumatic amputations of limbs, because the nerves that send signals, they still have an ending place in the brain, and so sometimes the brain doesn't know that organ's gone. People can still occasionally have symptoms after their gallbladder's out. Usually that's indicative that there's an issue. Sometimes people can have gallstones, we call primary stones that form in the bile ducts. That's very rare. I think I've maybe seen it once or twice in my 15, 20-year career.
Okay.
So by and large, that's not the same issue that it is for other regions of the body after let's say, an arm needs to be removed or something like that.
So my question is, so could the gallbladder like take a beating? I mean, is from somebody who has maybe a really poor diet and needs to maybe turn some things around, or somebody who has a relatively healthy diet? I mean, yeah, maybe some healthy fats here and there, but can that person suffer the same fate with their gallbladder as somebody who maybe has a really bad fatty diet? Is it, or some people susceptible to it, or?
I think it goes back to those risk factors. Females.
Okay, that's me.
People who are around 40, age 40.
Me.
People with excess weight shifts, whether that's gaining weight or losing weight.
Okay.
And so those are the risk factors. That's usually the population I expect to see have issues with their gallstones. Some of those things we can change, some of those things we can't change. The things that we all have control over is what kind of foods we eat.
It's the diet, yeah. It always goes back to that thing we have control over, the diet, the exercise, the movement. This is really interesting because the gallbladder is not an organ that we often talk about on this program, so I'm glad we are, and it makes me think twice again about saving the good fat for my, you're lumping all the fats into one, the good ones and the bad ones, so I got to really think about it hard. But anything else I'm not asking you about when it comes to, what else should we know?
There are about 700,000 to 1 million gallbladders removed in the United States a year, so it's a very common issue. It's a very common thing. So sometimes when people are going through an episode themselves, they think that something strange is going on, but it's a very common issue, very common problem. Don't be afraid to go have things evaluated, because as we talked about, there are some other things that can show up very similarly.
Yeah.
For most everyone that goes to have their gallbladder removed, it's usually an outpatient procedure. You can go home, usually most of my patients go home an hour after they're done.
Really? Okay.
The recovery is pretty straightforward. And so don't be afraid of gallbladder disease. Go ahead and enjoy your Christmas and Thanksgiving and holiday meals. But yes, we do see an uptick because people are consuming more food and more fat.
So so when you say gallbladder disease, is that what you're talking about? Something that then makes you have to have your gallbladder removed, or can it move into like gallbladder cancer?
Gallbladder cancer is a thing.
Okay.
We see it pretty rarely.
Okay.
I'd say the take-home message talking about gallbladder cancer is that probably you don't have gallbladder cancer. You probably have something very common, like
that could be
symptomatic,
fixed.
Symptomatic gallstones. Some people might have biliary dyskinesia, where simply the gallbladder doesn't empty like it's supposed to, and it gets overfull, and that makes people uncomfortable. People can have cholecystitis, which often has gallstones, but doesn't necessarily require gallstones to inflame the gallbladder.
So you're saying if you're going to have a problem, this might be not the worst problem to have, and it can be fixable.
Yeah,
so
but go ahead and get it addressed. Don't avoid a problem. Face it, and there are a ton of healthcare providers who have expertise in gallbladder symptoms, what it is, how to work it up, and then ultimately how to take care of the problem.
Thank you for coming in today. We appreciate you.
Thanks for having me.
All right, Dr. Hawkins, and let's get to your final thoughts today.
Yeah, I mean, again, just from our question, again, thank you to our guest, and always very helpful to get those questions out of the way. I know that it affects so many people every day, so thank you very much, Dr. Stone. And overall, one of our questions was about wastewater testing and testing for polio. Again, the main point here is if you are protected, if your loved ones are protected by vaccines, which you should have gotten and your children should have gotten, it is not a problem. And overall, yes, I think we need more surveillance all over the world for different emerging infections and re-emerging infections such as polio, but even those things we don't know about yet. And hopefully, as we are coming out of this pandemic in many different ways and reasons, we will start to build those infrastructures and get those surveillance systems set up.
Doc Hawk, thanks so much, and thank you for being with us today. You can catch our updates anytime by logging back onto Facebook, YouTube, and Twitter. Tomorrow, we'll share how this father-daughter duo is walking the path of Alzheimer's together with grace and dignity. Plus, we are joined by the Stowers Institute and our Alzheimer's researcher to discuss the latest advancements and approved FDA medication to treat this disease. We'll see you Tuesday at 8. We want want to let you know that starting next week, we will be taking a couple of weeks off from our program so that we can spend some time with our families.
The good news is you'll still be able to watch our morning medical update every weekday and All Things Heart on Thursdays.
That's right. We have chosen some of our very favorite episodes from the last year as encores, and we've recorded some pretty fun introductions to help remind you what each of those episodes is about. Wait until you see how many ugly Christmas sweaters Dr. Stites and Dr. Hawkinson own. Very interesting.
I can't wait. And then we return with live programming on Wednesday, January 4th. Until then,
Happy holidays.
Subscribe to our morning medical update and Open Mics with Dr. Stites podcast. Now, everywhere podcasts are available.